Is fluoride poisonous? Many of us have at least some knowledge about fluoride, especially from the toothpaste we use every day. But what exactly is fluoride? First, let's look at its nature. Fluoride comes from the element fluorine. In nature, fluorine exists as a highly reactive element, but when it enters the human body or is present in food and drinks, it appears as a negatively charged ion called fluoride. This is the form that functions in our bodies and helps strengthen our teeth and bones. Fluoride is not only found in man-made dental products such as toothpaste and mouthwash. It can also occur naturally in water, apples, and even tea. In fact, this element plays an important role not only in tooth and bone development, but also in the functioning of various organs, hormones, and the nervous system. So if fluoride is such a useful element, why does it sometimes cause fear? Fluoride is considered one of the important elements that support human health, and its protective effect against tooth decay has been demonstrated in many scientific studies. However, as with many things in life, excessive intake can be harmful. Just as drinking an excessive amount of water can even lead to serious health problems, consuming too much fluoride can also cause unwanted effects in the body. But it is important to clarify something here. When we talk about excessive fluoride, we mean large amounts being swallowed, not the normal use of fluoride products like brushing or rinsing. Now, let's look more closely at how fluoride works on teeth. Our teeth are made up of countless microscopic crystals called hydroxyapatite. These crystals form the main structure of the tooth, but they are also the first parts affected during tooth decay. As these crystals are damaged by acids produced by bacteria, the decay process begins and the tooth becomes weaker and softer. When fluoride comes into contact with the tooth surface, it reacts with these hydroxyapatite crystals and forms fluorapatite crystals, which are more resistant to acid attacks than hydroxyapatite. This makes the tooth structure stronger and more resistant to cavities. That is why fluoride in toothpaste helps protect our teeth. However, this protective layer is temporary. Over time, due to food, drinks, and saliva, fluorapatite can dissolve and the tooth structure may return to hydroxyapatite again. This is why regular brushing with fluoride toothpaste is important to maintain continuous protection. So where does the danger of fluoride actually appear? As mentioned earlier, problems occur only when very large amounts are swallowed at once, for example, by ingesting large quantities of toothpaste. The harmful dose varies depending on body weight. On average, about 5 milligrams of fluoride per kilogram of body weight may cause toxic effects. For example, a person weighing 70 kilograms would need to ingest about 350 milligrams of fluoride. If we assume that one tube of toothpaste contains about 1 milligram of fluoride, a person would need to consume around 350 tubes of toothpaste at once to reach that amount. Considering that we use a very small amount of toothpaste when brushing and spit most of it out, the risk of fluoride poisoning from normal toothpaste use is extremely low unless someone intentionally consumes large quantities. Another topic often discussed is fluoride stains on teeth, known as dental fluorosis. This usually occurs during the tooth development period between the ages of 0 and 8, especially in regions where drinking water contains very high levels of fluoride. In such cases, excessive fluoride intake during childhood may cause white or cloudy spots on the teeth. It is important to know that this condition is not harmful to the teeth themselves. It is mainly a cosmetic concern. Today, these spots can be improved with treatments such as whitening procedures, microabrasion, or dental veneers. To conclude, fluoride does not cause problems through brushing or rinsing. Issues occur only when large amounts are swallowed. When used properly, fluoride is an important element that helps protect teeth against decay and supports the healthy functioning of the body.